Attending school in the days of the pandemic, whether in person or from home, presents a host of health challenges for young people as they spend more time on those digital screens. Donna Mazik is the Executive Director of the National Association of School Nurses. She is here with Dr. Rupa Wong to provide some tips to create healthier learning environments for our kids. Welcome, ladies. So glad to have you on the show.
Thanks for having us.
Donna, I'll begin with you as a school nurse. What are some of the concerns you have? What are you seeing?
Well, school nurses are prioritizing health and safety for all students, whether they're meeting in person in school or in the virtual environment. And some of the concerns are across both those areas. School nurses are noticing that wellness and prevention healthcare visits were reduced because of pandemic closures in the spring and summer. And so making sure school nurses are making sure students are up to date on their immunizations and that their parents are scheduling an annual flu vaccine. That's whether they're in person or virtual. What's distinctive for the virtual environment is making sure that the learning place where children are in their homes or where they are living, that there's good lighting, that there's where that student is learning, that the device that they're using is some distance away from their eyes, and also that they are sitting with good posture so that they are reducing strain to their neck and their bodies as they learn virtually at home.
Dr. Wong, let's talk about your concerns and perhaps give parents and grandparents, caregivers some tips on keeping our kids safe, some ways that we can protect their vision.
Before, we used to just think nearsightedness was only genetic, but there are a lot of lifestyle factors that are coming into play. The reduced time that children are spending outdoors, the increasing amount of time that they're spending on near work, whether it's reading a book or on a device. And for some parents, they are not nearsighted, so they don't really understand what their child sees. So there's a great website. It's coopervision.com, and it actually has a myopia simulator. So it simulates what nearsightedness looks like for your child. If your child is nearsighted, it shows a picture of a gym as well as a classroom, and parents can toggle back and forth. And on that same website, it's actually a myopia quiz. Parents can just answer 6 questions and find out the likelihood that their child might end up being nearsighted. At home, a really simple test that you can do. And again, none of these replace getting a comprehensive eye examination by your eye doctor, but at least it alerts you if there's any issues. A real simple test: stand 20 feet away from the microwave oven, have your child look at the digital display with each eye and see if they can read the numbers. That's about 20/20, those numbers. So if they're having an issue, it could indicate that there's a vision disorder at play and you need to make an appointment with your eye care professional. You know, as a mom of 3 children and a pediatric ophthalmologist, in the past, I couldn't really offer parents that much if their kids' nearsightedness was just getting worse and worse. And now there's actually a new FDA-approved contact lens that's called MiSight, and it's shown to slow nearsightedness progression when treatment started in kids at ages 8 through 12. So it's a really great tool that we have in our tool belt now to be able to help children, especially when they're doing all this distance learning.
Well, ladies, I wish I had more time to talk to both of you because I've just barely hit the tip of the iceberg. But thank you so much for guiding us in this interesting time. Donna, Dr. Wong, thank you both.
Thank you.
We'll be back with more Local Lifestyles after this message. Stay with us.